Hi everyone, my name is Yi. I'm your host for Occupational Medicine Pearls podcast. As a second episode and non-ionizing radiation, I want to talk about radio frequency radiation or RF EMR. Radio wave is an invisible type of electromagnetic radiation and it can be used to transfer data and energy. So, a radio frequency RF is simply the rate at which these waves vibrate, and we measure that in hertz. Radio frequency RF electromagnetic radiation, it lies in the frequency range between 100 kilohertz to 300 gigahertz. So it's a relatively wide range, and it is non-ionizing radiation. That means that it has insufficient energy to break electron out of its place or to break chemical bonds. You can call that as an ionization. Now, there are a lot of different type of waves involved in here under the category, so they all have different effects. But for simplicity, we keep under the same heading. So radio waves that are used for broadcast radio or TV are different to 5G or telephone waves, or the one that are used in satellites and radars. They have different frequency and different wavelengths. RF EMR is produced by both natural and artificial sources. Natural sources like the sun, the earth, and ionosphere all emit low-level RF field, so we are covered or surrounded by them all the time. RF EMR has both electric and magnetic field components, and therefore it is convenient to express the strength of the RF field in terms of each component since they have different effects. And the unit volt per minute V/M is used to measure the electric field strength, and the unit amperes per meter is used to express magnetic field strength. Another common way to characterize an RF field is by means of power density. Power density is expressed as in the units of watts per square meter, and this is used to measure how much body is absorbed, and it is called specific absorption rate or SAR. SAR is something we need to know, and it is usually expressed in units of watts per kilogram or milliwatts per gram. Where do we expose from? So I mentioned briefly about natural resources from occupational health setting, telecommunication towers, so phone towers, base station, radio broadcast tower, radar, so that are used in aviation, maritime, weather, or defense. In the industry, RF dielectric sealers or welders, induction heaters, RF dryers used in timber or textile industry, or if they are high intensity industrial microwave heating. In the medical field, we use diathermy, which is shortwave microwave, and there are also in MRI as well. Use RF ablation, hypothermia units. If there is a research particle, such as particle accelerator, we have RF there. From the airport security, we have millimeter wave body scanners and also anti-drone systems. So they are the weapon that protect or use against drones. In the defense, previously mentioned, we already know they have high power radar, electronic warfare systems, and direct energy weapons. If we have one, they could put occupational resource. So how does it impact us? Mostly, if you already knew that they are a wave, they create energy. So think about that. It's all about heating. So they stimulate the molecules in our body and cause heating. And so the kinetic energy in terms of the effect is dependent on the dosage. The term that I mentioned before, specific absorption rate, that is important, and we use them as a primary dosimetric measurement. It also has non-thermal effects, but because it can change the ionization of the cellular membrane, we don't really know exactly how does that impact in the higher dose, sufficient dose. For the exam purposes, we need to know that there is a standard for Australia, but I don't think we need to exactly remember it. They are mentioned in the apprentice legislation about RF EMR standard, and we need to know where to look it up. Who are at risk of exposing high dose of occupation. So occupational exposure and public exposure are different, and the difference is the same with any other hazard. People who are working know what risk they are going into. They make a voluntary choice to do that role. As an employer, you have duty of care to inform them what are they signing up as well. Whereas public exposure, they don't give consent to expose to these radiation, so their limit are lower. Telecommunication tower workers such as riggers or maintenance technician, engineers working on the broadcast station, radar operators that may be in the aviation, maritime, or in the defense. Microwave or RF equipment operators in the industrial setting, such as welding and sealing. If a clinician or healthcare provider is using microwave or shockwave diathermy treatment, interventional radiologists using RF ablation, and airport security staff member who operate body scanners. What are established health effects? Mostly it is heating, so it may experience localized tissue heating and it may cause burn at high or sufficient density. Because of the heat and the frequency, it may cause heating, contribute to cataract, but now quite rare these days. And there should not be a lot of reason for other core body heating or genital area heating. Most of the effects should be confined to the skin only. I found this statement on a printer website stating that the employer should advise the pregnant worker as soon as they inform that they are pregnancy, that these pregnant workers should not be exposed to RFEME level, not more than public exposure limit. So it essentially prevent or may choose to stop working in the higher exposure employments. This radio frequency wave can cause cancer. Well, we are not sure, but IARC put as group 2B. The context is from mobile phone and the association between glioma. So it is not due to general occupational wave exposure, and it doesn't establish that causation. It is that it may increase or be associated with having the glioma in people who use mobile phone. So it is hard to apply that as a blanket rule for everyone who has exposure. There's also a term called electromagnetic hypersensitivity, which has symptoms of headaches and sleep disturbance in certain individuals due to exposure with the radio frequency waves or 5Gs. There is no consistent evidence between these symptoms and the radio frequency wave as a causal association. So generally speaking, there is no established increased cancer risk from occupational RF exposure at the current standard level. How do we monitor and assessment? So you can use the RF field or band meters to measure the wavelength or the intensity of the dosage. There is RF dosimeters if useful for occupational exposure monitoring, and they can be used when people are going up to radio towers to operate on. Control measure point of view, for elimination and substitution, can we operate or can we use things like drones for maintenance work instead of going near the radio towers? Can we replace diathermy with alternate therapy modalities? So from engineering point of view, interlock systems are useful. So transmission of one which you need to access the inside of a machine, or rigid reduction of the power output during maintenance stage, and use of the shield to block the RF. So that will be like Faraday cage enclosures. Administratively, we want to have signboards or lines or zone separation stating that there is the RF transmitters so that people do not go closer. And people who are going to work near the towers should have appropriate guidance and health assessment to ensure they are safe to work there, and restrict the time that they spend near the towers with job rotation. PPE is that there is limited effectiveness or limited evidence that they are useful. So they may be used in specialized high power situations and may not be applicable for our current exam, but general PPE does not provide any meaningful attenuation for the RF wave. So that's all about radio frequency. I hope this is useful to you, and I will go on to the next topic and the non-ionizing radiation.